Welcome to our third episode of the Artsakh Podcast, featuring Gevis Gadjan, Executive Director of ANC Artsakh, and myself, Hago Pipjan, Advisor of the President of the Republic of Artsakh. We are currently on day 265 of the blockade. Today, we have the honor of welcoming a truly exceptional guest on our podcast. Join us in conversation with Vardan Tadevosyan, the current healthcare minister of the Republic of Artsakh and former director of the Lady Cox Rehabilitation Centre in Stepanakert. His journey spans from healing war-torn lives in Artsakh to championing independence and dismantling disability stigma through an internationally acclaimed centre of excellence.
So on today's episode, we're going to delve into the health effects of this blockade, how they have compounded, and how the healthcare professionals, the health ministry, and everyone working in this field is working to combat all of the challenges and difficulties that we face.
Before we start, I think we have to note the events of the week. This week, we've had a few events. Firstly, the President of the Republic resigned, and before that, 3 young students were abducted while trying to be transferred to their universities in the Republic of Armenia.
And following those developments, we've seen, as Hagop just mentioned, some changes in the governance of Artsakh. But I think what's important, what we need to keep in mind, is that Artsakh is going to continue functioning with its full capabilities, and the people are going to keep persevering and tackling all the challenges ahead, regardless of who's in power and who's not.
The state minister also resigned, and a new state minister has been appointed. He will start working with the current staff, and no changes are foreseen for the time being. Well, coming to our guest, Mr. Tadevosyan, thank you very much for being here with us. We would like to start our podcast by asking you a few questions about the ongoing difficulties that you're having by being the healthcare minister. And one of the first questions that I would like to ask you, what are the major problems the Artsakh healthcare system faces today? Is the crisis under control? What is the healthcare ministry doing to be able to accommodate?
Okay, thank you very much inviting me over here. I'll try to answer as open and honest as much as I can. Well, of course, the blockade makes really one of the most vulnerable part is becoming the healthcare. I'm appointed as a health minister since 15th of March, and soon will be already 6 months since I make new responsibilities, because I was in Karabakh last more than 24 years, and all the time I was responsible to establish a new kind of medicine in Artsakh, which wasn't unknown. It's a rehabilitation for people with different kinds of disabilities, mental and physical disabilities, and this is also for me new responsibilities. But unfortunately, since I start my work in March, I faced with really not new for me. Also, it would be unknown responsibilities for all previous ministers of health, because we are faced the situation that many doctors already left, and this makes the work in hospitals in the regions and also in Stepanakert more and more difficult, and this brings to the situation that more and more people with different kind of illnesses and sicknesses, they want to transfer to Armenia. And plus, this is the only way for the people of Artsakh to move from Artsakh to Armenia. So can you imagine how many people want to live, which makes really very difficult my work as a minister, the person who make to decide who has to go. And I have to make decision according to the doctor's prescription that they need to be transported to Armenia for the further treatment. Well, this is one of the big difficulties that myself having being as a health minister, and of course in generally health system is vulnerable because all the medicine we were imported from Armenia for the hospitals. And during 9 months, soon will be 9 months, that blockade starts, we were chance also with the Russian peacemakers and also with the Red Cross support to import many kind of medicine that we were short, and we were bring more than we needed for the short period, also for the long period, and we distributed to our medical warehouses and in
Mm.
hospitals. But unfortunately, when the blockade is fully blockading, that means we have to stop our planned surgeries and treatment for the patients, because for the surgeries we need a lot of medical materials, which we are of course short, and we have to make only in emergency situation to
So,
use.
Mr. Vardan, how is the government coping? Were we prepared for something like this? Do we have the correct institutions in place, or?
Fortunately, yes, we were prepared for this, and we were imported many kind of the medicine. We were imported enough quantity, and which will be enough maybe next 2 months, no longer. But we were short, for example, recently for the baby's food, that thanks to the president, he was organized, and many other supporters from Armenia and from Spurk, they organized to get enough quantity and to send it through Russian peacekeepers.
Mr. Tadevosyan, one thing I've noticed when you go to your regular pharmacies, essentially most of them are completely empty, minus a few things. So the medical supplies that are coming in, are they for emergency care? Are they for the hospitals mainly? And how do you guys differentiate? You only have a finite amount of things that can come in because of the transportation issues. How do you differentiate what comes in and what doesn't?
Well, first of all, we have to take care for our hospitals, and we do our best to give chance our doctors to make their surgeries. But also for the public, we need to bring enough medicine for the public medical warehouses where the population can get. Unfortunately, this is almost impossible to do that. But we continuing health ministry to collaborate with Red Cross and Russian peacekeepers. And also we're collaborating with the owners of these medical warehouses, and we provide them as much as we can. But of course, in public medical warehouses, empty, almost empty, with the difficulties getting the most important, like painkillers and this kind of, or medicine for high blood pressure. This is some things, some medicine is really very important to have. But good to say that in the hospitals we are still safe, and we can provide to the people who has privilege to get this important medicine, as they are chronic
diseases.
Chronic diseases, and they have a privilege to get free of charge from the state. Of course, there are people who has disabilities, people who above 73 years old, and people under 18 years old. So those and many others are having privilege to get free of charge. But for others, unfortunately, we can't provide, and we can't even sell for them. We have to keep for the people who already
need it the most.
Yeah. But the situation is not as well as we want to see, unfortunately. But medical warehouses collaborating with us, and we're trying to bring as much as possible for them as well. last few weeks, the main problem was to bring as much as possible for the baby's food, and we have enough right now and for the next few weeks. And now we are working with our friends in Armenia and in diaspora, the special food for the babies and for the pregnant women, especially the women who are feeding by breast their babies. And these are important vitamins that they need to get because of lack of food. Of course, this is bringing
malnutrition becomes an issue.
Mr. Minister, the medical facilities here in Stepanakert, we understand that they get the most attention. What about the regional centers? Are we able to provide them with the same standard, or because of the lack of fuel, I believe there's some difficulty getting the necessary medication and everything that they need?
Yeah, thank you for the question, but believe me, whatever we provide for the Stepanakert hospital, we feel fully responsible to provide in Martakert, Askeran and Martuni regional hospitals. But unfortunately, the medicine and medical health ministry and all the medical world in Artsakh, depending right now in these days, not as much from medicine, but much more depending from the fuel. Because without transport, you can't transport the patients. The patient can visit to see their doctors. The doctors having big difficulties to go and to see their patients. We are providing fuel only for emergency vehicles to keep going to visit for the emergency calls. Of course, this brings the difficulties with the regional hospitals to send their patients for further investigation, in especially laboratory investigation, or to see the only doctor in Stepanakert. So these days, I think they're able to send twice a week by their vehicle patients to Stepanakert and back. And the situation day by day becoming worse and worse. And more challenges coming every day.
More complicated as we're going through.
Exactly. And unfortunately, but I'm happy to say we're still alive and we're continuing to fight. But these days, we are more faced difficulties with the fuel than with the medicine. And also, the biggest problem also in hospitals, this is important to mention, it's a food problem. So the last few days, hospitals unable to get the bread.
Because of the absence of flour.
Exactly.
For our listeners, we need to clarify that.
And how you can treat patients when you can't provide them enough quantity of the food. The words are.
We need to tell our listeners, Mr. Minister, that flour is scarce in the Republic at the moment. There is no bread. The bakeries are not producing bread because there's the absence of flour. We're having a really difficult times now, finding the simplest thing, which is bread.
That's one of, I think, in terms of how we combat this, even from a health perspective. How does the issues of, as you mentioned, it's not just about the lack of medicine, the lack of food has an effect. The lack of fuel, I would say, has an effect too, right? We've got people that might not be living in city centers, might be living in villages. How are we making sure that, they're tended to? And how are, something that's interesting to me, how are all of these conditions affecting your staff? How is it affecting the doctors and the nurses in Stepanakert as well, and throughout Artsakh?
Well, it's a good question. Thank you. Because, some people, sure, and this is, it's a myth that the doctors never become sick and they can't be ill. And all these difficulties also for medical staff, the same for all doctors, nurses, and the medical carers, and for the employees in a health ministry. Well, some of my employees walk to their duties to make. They have to walk 90 minutes walk in the mornings and 1 hour and a half in the evening back to home. They having the same difficulties. They have no time to go to the market to try to get anything, whatever is possible for that day. So for them it's more difficult because they are not unemployed like many other professionals that because of the situation they stop to work and they forced in holiday.
And finding produce, food, bread lines, all that stuff takes time, right? And if you're a doctor working 12 hours, 10 hours a day, you can't allocate. You can't allocate that time for your own family.
And that's why nobody is surprised that many doctors want to leave, and they're trying to get some way to leave the country, as the others, of course. Of course, this is the most difficult times for the people who has children at home, especially very young children. And of course, their wives and the mother of children is not working. They're taking care of children. And the father, as a doctor, 8 to 10 hours works with the patients and come in the evening home, and he has to think overnight to have a curing for bread at the night. This is, unbelievable situation for the people from outside, and for us. A few months ago, we could see this situation in our. I don't know what kind of evil dreams you can see this situation.
So not only are they like shouldering a big, massive part of this burden professionally, but a part of their personal lives are sacrificed for the well-being of the state, for the well-being of the health of the state.
Mr. Minister, I wanted to ask, with the chronic diseases, I know we've been to some meetings and there's a surge in them, isn't there now? So we've got an increase of diabetics, is that correct? How are we combating that? What are we doing towards that? Do we have enough insulin?
Yeah, fortunately we have enough insulin, but people who were using insulin, for example, one quantity, let's say this, now they have to use 4 quantity daily to use, so a few times more, because they can't keep their diet in the right nutrition, in the right food. So they eat food now because they're forced to eat and nothing else that before they were educated to avoid. This is they are one of the most vulnerable people in these days. But we were lucky to a few weeks ago to organize around 30 our patients who have chronic disease to using hydrodialysis. We were able to evacuate to Armenia, and thanks to the Armenian healthcare system and health ministry, they were supportive in this. So we had 45, so now is around 12 patients still are here. They were afraid to cross the border because of the...
Is the ICRC facilitating these evacuations?
Thanks to God, we're collaborating with ICRC, and they were very supportive in this. So these people were forced to leave the country, their motherland, to go to Yerevan, to live there, to get their treatment, continue to get, because we anticipate that in a couple months later we can't continue to use our dialysis machines because we will be lack of the medicine and necessary medical equipment to continue to use these machines. That's why it was made right decision to evacuate all these patients. But unfortunately, it's around 12 patients still are here, and they're continuing to get this treatment.
Mr. Tadevosyan, one question that I want to ask, and it's been on my mind when I first came to Artsakh about a year and a half ago. The first thing that we did with our ANC office was visit the Lady Cox Centre. And you guys do incredible work there, and not just incredible work for Artsakh, but the region, and you guys are affecting the lives of lots of kids who have issues like autism and kids that are on the spectrum, things that have been taboo for so long in the system within our culture. I'm wondering today, how are these compounded difficulties affecting those kids and their families, and how are you guys at the Lady Cox Center able to kind of, face these challenges?
Well, of course, the same difficulties is going on in the rehabilitation center. But I'm really happy to have such a team as operating there and taking this chance to say my thanks to all of them. The center is still now operating fully, and which will surprise you.
Mr. Vardan, sorry, before you continue, just tell us a little bit about the center.
I will. Thank you. And I'm happy to tell that even in these difficult days, the hydrotherapy facilities didn't stop. We organized in May to change our burner to the diesel, and to get enough diesel in those days that we will continue to this treatment, I hope, till the end of this year. This is quite expensive service, but we are happy to do, because this is not only treatment, also this is joy and fun for children, for the patient with disabilities. And staff continue to work really with all their heart with this kind of people. The Rehabilitation Center was founded in 1998 by Baroness Cox to support people who has a disability during the war and after the war. And rehabilitation services in the world is quite famous, but in post-Soviet countries it was not known even. Just to tell that the doctors they are professors, they are doctors, they are graduated medical universities, but they had any idea about rehabilitation medicine. For them, my profession looks like massage makers, and that's all. And but I used to that because I'm founder of the Rehabilitation Center in Yerevan as well. So the same difficulties faced in the beginning of 90s there as well. So I was really very happy that I got offer by Baroness to move to Artsakh and to establish this service and to bring new kind of medicine in Artsakh.
Would you say that the government supports the efforts, and does the current minister support the efforts
Definitely.
of the Lady Cox?
Of course, we started to collaborate with Health Ministry since 2002, and our budget is totally funded by Health Ministry. And of course, our donors, supporters, and Lady Cox, they do all the additional projects that we are really faced, but we have no budget to get or to anticipate to get from the state. And, this center is quite unique if I see in not comparing with Armenia, because for me, nothing to compare in Armenia, because when I established here a rehabilitation center, even in Armenia was just a couple of rehab centers. Now they have more than 50 rehabilitation centers. In Artsakh, unfortunately, still the only rehabilitation center. But it's unique because even in many other countries where I traveled, and I was traveled in many famous rehabilitation centers, I haven't seen rehabilitation service in one building that professionals are trained professionally to take care for physically disabled people, for mental disability, children and adults. And also we have department totally designed and qualified professionals are working with children who has autistic syndromes. So children who not only autistic children, including their separate group for children who have physical and mental disabilities. And even more, we since last year, we support our patients with their, especially their parents, to providing them professional minibuses to go home, to transport to the rehabilitation center, and after the treatment, to transport them to back to families. And this service is still alive. And after tomorrow, actually, on the 4th of September, we will reopen after a holiday. 1 month in August, they were in holiday. And I hope I have a little diesel that I can provide to start this project to support the parents. And of course, every day I believe that maybe next couple of days, the
better,
problem will be solved, and we will get the fuel and all the medical.
But the supplies aren't unlimited, right? There's a chance that we might have to cut some of these services if we can't find the appropriate resources.
Unfortunately, I know I work in a government, and I know our resources are almost empty. So I'm afraid it will be day if this will continue, that the emergency vehicles, we can't provide them necessary amount of the fuel. We work with the doctors that they have to try as many as possible to support the emergency calls, to operate with the people by phone, what they can do to get the first help, and maybe it's not necessary the doctor's visit, so they can save some fuel visiting not so important cases that to visit. But we are on a phase that one day we will be totally empty. We will be without any fuel. So it's a philosophical question: which is more important, the fuel or the medicine?
Yeah.
Gents, I'm sorry, but we need to wrap it up. Okay, this has been a pleasure talking to you,
My pleasure.
Mr. Minister. We want to extend our heartfelt gratitude that again that you accepted to come here and talk to us, and your valuable insights that you provided us.
And look, we're a believer in that. We're going through tough days, and better days will come. And when this blockade is eventually lifted, we want you guys to keep the health ministry in mind. We want you guys to keep the Lady Cox Rehabilitation Centre in mind, because we're going to need the funds. We're going to need the resources to continue these amazing services. So pay attention to Artsakh even through the crisis and beyond.
I want to say that today is the 2nd of September. We're recording. There's protests everywhere in the world. People should join those protesters. I know our podcast is it's going to come on Monday, but I think every week there'll be protests in different countries, and I believe every Armenian or every non-Armenian that wants to support the cause, wants this blockade to be lifted, has to join, has to support. We need all the help that we can get. Special thank you goes to Artsakh TV, the 301, and Artsakh Radio for providing us this platform to have this important conversation. To all our listeners, we sincerely appreciate your time and attention. We want to let you know we're committed to continuing this podcast journey, shedding light on the ground realities and ongoing developments.
And as always, you guys can find us everywhere: Apple, Google, Amazon, and anywhere else that podcasts are found. Stay tuned till next week.
Thank you.
Thank you.